My name is Fidelis Njoki, and my sign name is that one. I'm a student doing diploma in social work. I went to primary school in different primary schools. I think they're around 7. I joined a unit when I was in class 6. Then from class 6 to class 8, I completed my primary level. Then I stayed 1 year at home after doing my KCP exam from Form 1 to Form 4. Then I joined the college in 2016, which I'm still doing diploma in social work, because I love working with the society. The main challenge when in primary school, when I joined primary school, it was difficult for people to understand me. And it was also difficult for them to stay with me because of the communication barrier. So I'm lucky that I could lip read. But the problem which I had, people could laugh at me when I could speak, because most of the time, because I was forced to always read in class. And I think it was an advantage for me, and it also had some disadvantages for me. The advantage to me, it made me to always speak. But the disadvantage, people always laughed at me. And also some people could make fun of me. So that was the biggest challenge. So I never knew that there was a deaf school or there was a deaf ward. I always thought I was the only one.
That time I wanted to do law.
I wanted to do law. But my parents wanted me to do teaching. My father believed that I've already made up my decision.
So we tried
University, but they said if you want to join to do law, you bring your own interpreter. So it was difficult to pay school fees and at the same time to pay an interpreter. I felt it was not good because the fees was too high. So I thought no. We sat down, discussed. Then later, my father asked me, "Are you okay in doing social work?" I said yes. I said yes because I love working with the community, and I felt it was okay. But I do not have any interpreter. Though I know my rights,
all my classes.
when I finish all my classes, it's when I knew my rights.
If you join the school,
If you join the school,
ask for the service.
you must ask for services for them to give you good services.
So I knew that when it was too late.
But I knew all that when it was too late.
If I
What I think we can do to improve, the nurses, the doctors, they need to understand the deaf culture and also learn more science, especially on the medical terms. I would also urge the nurses and the doctors at least to be trained and to know that maybe if they see a person who can speak, then this person tells them I'm deaf, then they ask, how can you speak if you are deaf? They only believe if you are deaf, you are deaf and dumb. So they should know, at least if you speak, like for myself, sometimes I can speak, then they can tell me, can you stay on the line? Then I have to wait there for them to call names, then I can't hear when they are calling names. So it's always good they know that even if I can speak, I'm deaf. On issues to do with employment, we have some challenges. some people don't understand you. Maybe you go for an interview. If I don't have an interpreter, I try to be confident to speak. And I feel that the interview is okay. They say that myself, I'm deaf. Then this person changes the attitude. If you are deaf, it's somehow we cannot work with you. So I lose that opportunity. When we talk about the PWDs, people think that you have to see that disability, or you have to see maybe a blind person or a physical challenged person. But with the deaf people, the disability is not visible. So when you say that you're deaf, the people think that maybe you need pity or you need sympathy from them. So when they see maybe you are communicating using sign language, they feel that you can't do anything. Maybe they think you are mad. So they don't want